Welcome to Elevating Your Life, where each episode is dedicated to sharing valuable information, useful techniques, and empowering inspiration so that you can experience personal and physical abundance. Success and happiness are within your reach. I am your go-to gal who will help you find your happiness triggers and a true elevated life. I am your host, Paula Vail. Hello, everyone. Welcome. I'm so happy to share with you today an amazing gentleman who helps so many. I have with us today Dr. David Hanscom. He is an orthopedic complex spinal deformity surgeon who was based in Seattle, Washington. He quit his practice and is on a mission to reintroduce true healing into medicine. His book that we are going to talk about today, Do You Really Need Spine Surgery?, is absolutely fantastic. I just loved it, Doctor. It was fantastic, and I'm thrilled to share you and your information with my guests today. First off, welcome.
Thank you very much. I'm happy to be here.
Oh, so happy to have you. I would love for you to share a bit more of your background and what prompted you to write this fantastic book.
I started practice in Seattle in 1986, and I had gone to a very high-level spine fellowship. And you're basically taught as a surgeon that everything else has been tried, let's do surgery. It's sort of a common feeling amongst physicians and patients both. And I spent 8 years being a really aggressive surgeon. I did lots of fusions. I thought that a fusion for back pain was very definitive. I felt good about it. I did dozens and dozens of them. But my results were sort of scattered. They weren't bad. Then the data came out in 1993 out of the state of Washington, by the way, where the success rate for a spine fusion in the state of Washington for a workers' comp situation was about 22% success rate. So I thought it was 90%. And I looked at my own results, and I was at about 40 to 45%, but I also worked very hard with rehab. I'd also worked with a Dr. Stan Herring, who's a very well-known rehab doctor in Seattle, and he taught me about this non-operative part of spine care that surgeons aren't trained in. Jumping ahead, I actually developed chronic pain myself for about 15 years, which was horrible. I barely made it through. But I also learned that my patients with chronic pain suffer terribly. They don't feel like they're listened to, they're labeled. And what it does, it fires up the whole nervous system and causes what's called inflammatory cytokines. It causes diffuse inflammation. So when you're under stress, it's actually not a psychological term, it's an inflammatory term. So what happens under chronic stress, your body's inflammatory processes start destroying tissues. Then it turns out by doing surgery that's not necessary or helpful, you make the inflammatory process worse. Then the last 5 years, I watched patient after patient, literally hundreds of patients, go to pain-free, using methods to calm down the body's inflammation, some with surgery, most without. So I was watching these people get better with minimal risk, essentially self-directed. At the same time, I started seeing 3 to 5 patients every week coming into me with surgeries that should not have been done, that were badly damaged. And the divergence became so great, I said, look, I just have to stop this. So it turned out the last 5 years particularly, I think spine surgery has become predatory. I think it's dangerous. I think that doctors are I'm not going to vilify the physicians specifically because I think most of them by far and away want to actually talk to the patients. But the business of medicine has put us into this hole that we have to be productive. But the data shows that everything that we are actually profitable on has been documented to be ineffective. So I just said, stop. I'm not going to do this anymore. So I'm actually working probably 60 hours a week, busier now, trying to do what I can do, being on podcasts, writing, teaching, lecturing all over the world, saying, look, stop. This is not safe for you.
Yes. Well, I know I'm in your area, Tacoma, Washington, and about 10 years ago, I was hit sitting at a red light.
Okay.
And I was instructed to be best to do a surgery. So I had 2 surgeries in my area that I was in a lot more pain.
Okay.
And then in going to Seattle, my 3rd surgery, I've done a lot better since then. But it's really true that when we have that pain, there's a lot of anxiety and stress.
Right.
Would you say? And
Absolutely.
that tends to make someone, when a surgeon says, "Oh, well, let's just go operate," they're like, "Okay, whatever to fix it."
Right. I mean, you're desperate.
Mm-hmm.
I mean,
Exactly.
chronic pain is a terrible thing. The problem is that the success rate of surgery for pain. So here's the problem. After about 6 to 12 months, no matter where the pain starts, whether it's a bone spur, whatever starts with, whether it's a soft tissue inflammation or a bone spur or something structural, in about 6 to 12 months, your brain literally memorizes the pain. It's like riding a bicycle. And then you've heard of phantom limb pain. Well, I'm an orthopedic surgeon. I've done my share of amputations. It's pretty dramatic amputating a limb. The pain's still there. And the question is why? And what's happened is like riding a bicycle. Once those circuits are fired up, they're there. So not only do people with phantom limb pain feel the leg, they feel the same pain they had before the surgery. That happens in any part of the body. So when we start doing further surgeries on pain that's been there for more than a year, for sure, it actually has been documented over and over and over again to not work. In fact, there's not one research paper in 60 years that said we should be doing surgery for back pain. Not one.
Wow. So how do you address that pain? So what do you recommend to your patients to get them out of that pain? And what do you recommend?
Well, I did find eventually that the worst pain people have is actually the mental pain. So it's really, the bottom line is threat versus stress. So when you're feeling safe, in other words, the essence of solving chronic pain is feeling safe. When you feel safe, your body chemistry changes. You're full of oxytocin, dopamine, serotonin, really great chemical bath. Your nerve conduction slows down. The pain physically goes away. You feel better. Things change dramatically. But the other factor that's come into light the last few years is that when you're under stress, any threat, your body responds with adrenaline, cortisol, all sorts of drugs, but also inflames what's called cytokines, which are inflammatory, that actually cause physical tissue destruction. So then we found out that a threat could be a virus, bacteria, could be trauma, could be an angry boss. Your thoughts are also a threat that are processed the same way that a physical threat is. The problem that humans have is that we cannot escape our thoughts. Mm-hmm. So every human being is subjected to a certain amount of thoughts. If you repress the thoughts, it's also a threat. So what happens, you have a neurochemical survival response that we call anxiety. Anxiety is not psychological, it's the result of a threat. It's the body's total body response to a threat. So you have a thought that's unpleasant. Your body says danger. You secrete cytokines and the other chemicals. And then since you can't escape your thoughts, you're under chronic inflammation for years. So what we found out is that what's actually more intolerable than the physical pain is the mental pain. People cannot tolerate the anxiety. They can sort of deal with the pain, but the anxiety is what's intolerable. So the way you solve the problem is you simply, okay, so I'm going to ask you a rhetorical question. Anxiety is just a sensation created by the stress response. Just like you're on the beach in the sun, you're relaxed. Relaxed is not a diagnosis, it's a description. Anxiety is not a diagnosis, it's a description, and it is not a mental health issue. It's a total body response to a threat. The way you decrease anxiety is that you simply lower the stress chemicals. The issue is that the unconscious brain, of which this response is, processes about 20 million bits of information per second. The conscious brain processes 40. It's 20 million versus 40. You're not going to solve anxiety psychologically or mentally. It's totally out of control. You also need anxiety to survive. if you didn't have anxiety, we would not have evolved. The species of creatures who do not pay attention to the environmental cues, i.e. threat from any source, didn't survive. We're all programmed to avoid threats and gravitate towards rewards. We need the rewards to procreate, regenerate, and to restore our tissues. So the essence of solving chronic pain is actually feeling safe. Now that's a learned skill. I did write a book called Back in Control, A Surgeon's Roadmap Out of Chronic Pain. There's a website, backincontrol.com, that goes through a stepwise process to understand the neurological nature of chronic pain, to break up the circuits and start reprogramming. And you literally can program your way around anything. I have one gentleman who had 27 surgeries in 20 years, suicidal, depressed. He's pain-free. He has no pain. High-dose narcotics, alcoholism, the whole thing. He says he's not felt this good since he was 30 years old. He's now in his 60s. So it's a very self-directed process. It's taking known neurological principles. You're simply retraining your brain to go a different direction. So the key is a term called neuroplasticity that we know. So neuroplasticity is a term used to describe that the brain changes every second. And what happens in chronic pain, people's brains actually physically shrink. When you treat chronic pain, they re-expand. So you're actually causing structural changes in your brain to actually reroute your brain around the pain circuits.
Oh my gosh, this is so fascinating. Oh.
That's why I quit my practice, because I'm watching hundreds and hundreds of patients go to pain-free with simple, again, the website's backincontrol.com. There's 4 stages, and it starts with what's called expressive writing, which is you write down your thoughts and tear them up. And there's over 1,000 research papers that documents that it works. In fact, I'm holding a book in my hand here called Opening Up by Writing It Down by Dr. Pennebaker. I've met him. His daughter lives in Seattle, by the way. And he's a social psychologist who's been doing the research on expressive writing since 1982. We actually asked him the question, Jamie, what's going on? Why is this expressive writing work? He goes, I don't know. And I have a certain amount of disbelief that it actually does what it does, but you have improved athletic performance, grade performance. You have people heal their wounds twice as fast. It drops down rheumatoid arthritis, ankylosing spondylitis, asthma. It actually knocks down the viral load. It actually knocks down inflammation. It actually knocks down inflammation from anxiety and depression. So in my 15-year journey out of chronic pain, the first thing that started it was expressive writing. And even now, 15 years later, by the way, I am pain-free. I'm doing fine. After 15 years of chronic pain, I've been relatively pain-free since 2003. But it started with the expressive writing that this one author said, start to write. So I started to write. I thought it was the book. I had no idea in the data on the writing. But within 2 weeks after I started to write, things started to shift. By 6 months, I was pain-free. I was fine. Every patient that's gotten better has started with expressive writing with maybe exception of 10 out of over 1,000. So it's a one starting point. It's not the solution, but it is the starting point. So again, going back to the model, any threat, whether it's a physical threat or a mental threat, causes a total body response that says high alert. It starts a reaction on these cytokines to create inflammation in your body. That inflammation actually inflames the nerves themselves and it doubles the nerve conduction. You feel the pain more. As you switch off those cytokines and you go to a chemical bath of oxytocin, dopamine, and the great chemicals, nerve conduction slows down, your sense of well-being goes up, and things change dramatically. The fun part for me is that not only do people come out of the pit of chronic pain, they thrive. And they thrive at a level that they never knew existed. Because you're not fighting the anxiety anymore.
Yeah, you're not in that battle.
Right.
So please give us an example of if you're in pain and you're going to begin writing. So do you describe your pain, or what is the writing that you recommend they do?
There's a bunch of types of writing, but the one I have people start with is simply write down your thoughts. It can be positive or negative, it doesn't matter. You can't control your thoughts. You can suffer with them, you can try to suppress them, but you can't control your thoughts. So it's just a separation exercise. The thoughts are here, you're here. So you write down any thoughts, 5, 10, 15 minutes, once or twice a day, tear them up. and you're tearing them up not to get rid of them. And there's trillions of thoughts. You're not getting rid of these things, but you're separating. And you tear them up so not to analyze them. Because if you analyze them, your attention's on the thoughts, right? You're reinforcing. So the key is neuroplasticity. So with neuroplasticity, it's awareness, separation, then redirecting. So the writing creates an awareness of the thoughts. You've now physically separated, then you redirect.
Oh, I love that. It's like a release, isn't it?
Right.
Wow. Wow. Okay, so that is the first step. Then what would you say would be the next step?
Well, it's awareness separation, which with the expressive already done. And again, it's just does 2 steps in neuroplasticity. The first first reprogramming step that we teach people, and I call it active meditation, is just sit back in your chair for a second. You just place your attention on a different sensation for about 3 to 5 seconds, maybe 10 seconds. And so instead of having your mind doing battle with these racing thoughts, which are impossible, by the way, you just put your brain on a different sensation. So just feel the back of your chair, drop your shoulders, let your jaw muscles relax, and just feel where you're sitting. And we actually do this during surgery all the time. If we get a little frustrated or anxious, we just actually drop our shoulders and just go to light touch. Basically, it's mindfulness-based surgery, and our complication rate just dropped dramatically.
Wow.
But that's why we teach all of our fellows now. I started doing the process myself in 2006 during surgery. There's a dramatic improvement in consistency, but it's true for life in general. Anytime you're triggered or frustrated, just drop down your shoulders 3 to 5 seconds. The reason why I like the active meditation, because first of all, I don't have the patience to meditate, which I know is a bit of an oxymoron, but I just don't. And so what happens is real time. You just get, used to dropping your shoulders down, going to light touch, feel whatever it is. And what you're doing, you're now connected to the environment. So the solution again is feeling safe. You don't feel safe by pretending things are okay when they're not. I mean, if your checkbook balance is 0, you want to know it's 0. If you're worried about your checkbook being balanced, being 0, why, that's not great, but it's better to know it than not, right? Uncertainty is a big problem. So connecting what actually is in your brain, which by the way, all of us have a lot of anxiety and frustration. Mm-hmm. So you allow yourself, literally train your brain to feel anxious and allow it to feel angry. Then you do the writing relaxation, drop it down, and simply redirect. What you don't want to do is suppress the anxiety and frustration. What happened to me as a major spine surgeon, I was so used to suppressing anxiety that I honestly didn't even know what it meant. I wasn't connected to it. So all of a sudden I went from no anxiety to a panic attack in 10 minutes. Once a panic attack occurred, I ended up with 17 different symptoms of chronic pain over the next 15 years. It was brutal. But it turned out to be an inflammatory process. In other words, the panic attack was probably, we think, a cytokine storm, just a massive inflammatory reaction. Again, physiological, not psychological. I thought it was psychological, so I went to endless counseling and therapy to try to fix this thing. Couldn't do it. In fact, the more I talked about it, of course, my attention's on the pain, not the solution. And inadvertently, I was actually reinforcing it.
So getting your attention off the pain and not giving that your attention, right, is a big deal.
Correct. Because remember, the threat comes from any source. So the essence of solving chronic pain is feeling safe. And you feel safe by connecting to your own capacity to heal, but you have to connect with what is to heal. Yes. So if you're connected to looking good, feeling good, avoiding pain, pain is part of your life, is part of being alive, is part of staying alive. And then the process of healing is not about believing David Hanscom or believing my book. These are well-established medical treatments. I think the contribution that my book does is creates a structure to organize your thinking. Once you understand chronic pain and understand yourself, then you can easily figure out your own solution. Same thing with the surgical book. It takes into account 2 things. One is the anatomy. Is there something to fix or not? The other one is the state of your nervous system. So if you do surgery in a calm nervous system, people do great consistently. If you do an appropriate surgery in the face of a fired up nervous system, the results are all over the map. if you do surgery on a relatively normal spine where you can't really see the problem, people consistently do badly even with a calm nervous system. But if you take somebody who has no obvious source of pain and you do surgery in the face of a fired up nervous system, not only do you not make them better, there's about a 40 to 50% chance that they're made worse. In fact, that's what the data shows. So the data shows if you operate in the presence of untreated chronic pain without calming down the nervous system first, you actually can induce chronic pain or make it worse 40 to 60% of the time. But what happens, I think, you have these memorized circuits in your brain. You start plugging in body parts. Then when the surgery doesn't work, what do? You've lost hope even again, right?
Yes.
You've been through this, correct?
You do.
And when you lose hope, losing hope's a bad thing.
Yes.
And then nobody's telling you a way out of it. You're getting conflicting opinions. And I don't know your experience, but a lot of people get labeled, well, there's nothing really wrong. Or maybe, doctors that can't see a surgical problem get impatient. They don't want to spend that much time with you. I don't know if you experienced that or not.
I've experienced that. Oh, you're fine. I don't know what the problem is. Yeah.
Really?
I can't sleep. I'm in so much pain. Yeah.
Right. Can I ask you some of the experiences you had not being, people want to be heard, right? Remember, the essence of safety is actually being heard by your doctor. Mm-hmm. And in this age of corporate medicine, doctors are physically being forbidden to talk to their patients. It takes too much time.
Yes.
So if you can't feel safe with your doctor, where do you feel safe?
Yes.
Right?
Yeah.
So that's really a key. And we actually know in medicine that actually listening and having a doctor-patient relationship that's functional and powerful is actually the essence of healing. Mm-hmm. But what's happened, we've now gone to procedures that have been, by the way, documented to be ineffective, but we're actually forced to be, quote, productive, offering interventions that aren't effective.
Mm-hmm. Yeah. And, that really made me think about it. Before my third surgery, I went to a different surgeon and he did listen to me.
Uh-huh.
He gave me time.
Right.
And, that must have made a big difference.
It does.
That must have been one of the reasons that I did so much better after that.
Yep. Well, what happened, we started doing what's called prehab I call it prehab in my book. Every patient that wasn't emergent, we did 8 to 12 weeks of the sleep modification. We would stabilize medications. We would have them do the expressive writing, active meditation. There's a bunch of things that calm down the nervous system. And then what happened, I had over 100 patients with surgical problems actually on the schedule coming for their final visit. They canceled the surgery because the pain disappeared. I literally put myself out of business. And that's why going back to this gentleman with 27 surgeries, I did not think that was possible, but I swear you can literally program your brain around any pain. It's just repetition.
Oh gosh, David, this is so fascinating. I love it. This can help so many people. We just have a few more minutes in the show. Please share how the audience can get a hold of your book or get in contact with you, get information about you, and whatever last words you want to share with us today. I could go on for hours. This is fascinating.
I'd love to come back again. And we have all sorts of family issues we dealt with. We learned that anger and forgiveness is a big deal. It's all about the state of the nervous system, right? Mm-hmm. Anyway, the bottom line is I like to say chronic pain is curable, not to be managed. It's a solvable problem. It's mostly self-directed, and it's about feeling safe. And the first person you want to feel safe with is yourself, because we're not very safe from our own thoughts. So there's a whole process of learning to feel safe and be safe. My website is backincontrol.com, one word, backincontrol.com. That's the action plan of the book. And by learning the tools, but actually use them on a daily basis starts to change your brain. So repetition is key. I'm also going to say that spine surgery right now is not predictable. I think it's actually dangerous right now. And I'm a little frustrated because I actually quit my practice at the peak of my career to do this because there's such a great need to stop this craziness of spine surgery. We're really hurting people pretty badly. So there's a book called Do You Really Need Spine Surgery? Again, both of these are available on Amazon or Barnes & Noble. allows you to make a really clear decision, because I'm not against surgery, but it makes you, gives you a chance to make a very clear decision whether you should or should not have surgery. Then if you have the surgery, how do you optimize the outcome? We just had the best time watching patients get better with or without surgery, but it became a very, very consistent pattern of outcomes when we took care of the details before we did the surgery. Yeah. Surgery by itself is probably not going to help you out very much.
Yes, yes. Bring in those other modalities, the understanding our thoughts and the way the brain works. This is huge. I just have to tell you from the bottom of my heart, thank you for the information that you are sharing with so many people and affecting so many lives. I would love to have you on again and share more information. This is
wonderful. Well, thank you. This has been wonderful.
Doctor.
Yeah. So
I really am grateful to you for all this and the help that this will give others who are fighting pain, because there's a lot of pain out there.
Right. By the way, I also do an open forum every Tuesday and Thursday on my website. Just click a button and there's an open forum where people just come on and ask questions. It's very helpful for a lot of people too.
Oh,
very easy to find.
Fantastic.
Yes. So every Tuesday, every Thursday, 12 to 1 o'clock.
Okay.
It's a Zoom meeting and you just pop right on, and we've had a great time with that meeting.
Oh, that is fantastic. Oh, well, thank you so much. I'm so grateful, David, Dr. David. This has been great.
All right. Thank you.
Love, hugs, and blessings to you, and to everyone out there. Love, hugs, and blessings. Thank you for joining us. Bye.
Thank you.